Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we'll be talking about the prenatal period and your pelvic floor. So 90% of our patients at the clinic do a Kegel when asked to push or bear down. Now, how in the world are you going to get a baby out if you're performing a Kegel when asked to push or bear down? So educating your patients about how to push during a vaginal delivery is one of the most empowering skills our patients learn. They feel more confident going into labor, knowing that they actually know what pushing is. And we start this education at about the second trimester because it's much easier to connect to your pelvic floor when your belly is a little bit smaller and you're not in labor trying to figure it out.
We connect breathing to pelvic floor relaxation. We aim for lengthening the pelvic floor muscles and reducing trigger points that may be preventing this eccentric contraction of the pelvic floor muscles to help move the baby down the canal. What this means is that we want our patients to be able to do a great, amazing pelvic floor drop or relaxation because it's essentially the same movement as bearing down. This is the opposite of a Kegel or a contraction.
So we also educate about birth positions and just a quick tip, internal rotation of the hip actually can help to elongate the pelvic floor muscles and opens up the pelvic girdle. So that position that most women are in for birth is not so effective because of that big external rotation of the hip. And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges in providing care for your patients during the prenatal period.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll get access to our free weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're developing an online pelvic floor course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.